And negotiations do continue to prevent a nurses' strike threatening several hospitals across the city, especially in Brooklyn.
Yeah, public health is one of the main priorities that will be discussed during next week's State of the Borough address. So here to give us a little more insight is Brooklyn Borough President Antonio Reynoso. Good morning, Borough President. Thanks so much for being with us, and Happy New Year to you.
Happy New Year to you as well. Thank you so much for having me.
So let's get straight to it. So what hospitals across Brooklyn will be most impacted by this potential nurses' strike?
Well, almost every hospital except two in Brooklyn is going to be affected, including Maimonides, which is one of the largest hospitals in Brooklyn. So it's very concerning. And I'm glad that we have this 10-day break before, or this 10-day preparation period before the nurses' strike. But it's sad. We've been talking about nurses as heroes, banging pots and pans during the COVID-19 moments, and just for them to be preparing for a strike because we can't pay them well. They're understaffed. We're losing them to hospitals outside of New York City, outside of Brooklyn, because they get paid more elsewhere. It's just sad. It's just very sad that we've come to this point where, again, we call them heroes, but when it's time to negotiate a contract, and they're looking for a fair contract, we're not ready to show up and show them that we care.
Just real quickly, is there a backup plan?
There is not. The 10 days gives the hospitals an opportunity to start building a contingency plan, a backup plan. But they're already short-staffed. It's hard to find nurses in general, but especially in these hospitals, they're in for quite a disaster should the nurses not show up. So hopefully we don't get to that. Hopefully these nurses get to negotiate a fair contract within the next, 7 or 8 days now, and we could all walk away from this feeling a lot better. But it's sad that these nurses have to even ask for a fair contract. If you look at what they're asking, it's about staffing levels that are safe. It's about pay that is more comparable with Long Island and New Jersey. And it's just, we shouldn't be doing this during this time. We know the value of these nurses, and we should just give them their contract.
Absolutely. And Antonio, since we're talking about this nurses negotiation, that ties into public health. You're working on a public health conditions report, which is gathering information about the health outcomes across different neighborhoods. How will this information gathered in this report actually serve the residents of Brooklyn?
Yeah, so the first thing is knowing. So we just finished an existing conditions report for our comprehensive plan. What we're noticing is that institutionally and through land use and planning, the city of New York has put certain neighborhoods in positions where their health is of grave concern. You start seeing tree canopies in one area, not the other, expansive parks in one area, not the other, a lack of housing, a lack of food access. It's all related to planning. The city of New York was built making Manhattan and the Central Business District the center of the universe. As time has gone on, Brooklyn, Queens, and the Bronx have grown in population and have their own centers, but the city wasn't built to support that structure. So we're showing through our planning, comprehensive planning model, is that we can build and plan to take care of these health conditions that are plaguing us. There's one example in Brooklyn where one community has an expectancy, a life expectancy that's 10 years more than another part of a neighborhood in Brooklyn. That means if you live in one zip code, you're gonna die 10 years younger. And we could change that through planning. And well, we're hoping to start affecting that through planning. But those are the things we're finding out right now, and we think it's all related to poor planning by the city of New York.
Yeah. Well, let's switch gears a little bit and talk about what happened in Park Slope. Residents, they're concerned about sinkholes. I'm sure you saw that video. The FDNY truck got stuck on President Street. Any update on that situation?
No, I know it's an emergency issue that they're looking to of course, to take care of it immediately, and they will take care of it immediately. These are one of these moments when the Department of Transportation, the city, will show up. The problem we have is just an infrastructure problem. The city of New York mostly works on taking care of infrastructure in the city on emergency cases like this, or when there's development or development opportunities in a neighborhood. So what you see is that your streets are not paved, they're not well taken care of. Your public infrastructure like libraries and schools are problematic or overcrowded. But when development comes and you're about to get a 20, 30, and 40-story building in your neighborhood, all those infrastructure needs start getting addressed. And we want to change that. We want the city of New York to pay attention to this infrastructure, whether or not there's going to be development in a neighborhood. We shouldn't relegate these neighborhoods into these conditions just because they're not developing. And Park Slope, surprisingly, is one of those areas that needs infrastructure improvements, regardless of whether or not they're going to build.
Right. That incident was just a cascade of unfortunate things that came into play there. And speaking of infrastructure here, the Department of Transportation is still getting some feedback from Brooklyn residents on this proposal to fix the BQE. These repairs are going to obviously impact several neighborhoods. So when will the final proposal be revealed, and when is this work going to start?
Well, it's supposed to start quickly and immediately. The cantilever is literally falling apart. It's 25 years past its life expectancy. So we're talking about aging infrastructure that is very dangerous, not only for vehicle drivers, but for the neighbors that use the cantilever upstairs in the Park Slope section or the Brooklyn Heights section. I apologize, in the Brooklyn Heights section. The problem we're having with the planning of the BQE here is that they only want to fix the cantilever. And if you know anything about the BQE, from north to south, Sunset Park, Red Hook, Williamsburg, Greenpoint, those are areas that have huge, huge health issues. The highest asthma rates in the city of New York, all along this corridor that was built at a time when transportation policy, I guess, was not where it is today. We need to rethink this, and we need it to be corridor wide. What we're seeing is the mayor's office is focused solely on the Brooklyn Heights area. The rest of the BQE actually belongs to the state. So if the governor doesn't come in and work alongside Mayor Eric Adams, what we're going to see is more of the same. Areas like Brooklyn Heights that tend to be extremely affluent and well off get infrastructure upgrades, and areas like Williamsburg, Greenpoint, Sunset Park get ignored, which is probably what's going to happen here.
Yeah. Before we let you go, I know you're delivering your State of the Borough address just 1 week from tomorrow. Can you give us a preview? What are your top priorities for your borough in 2023?
Yeah, it's all related to public health. So what we're trying to do here is that traditionally the borough president's office is a ceremonial position, and we're changing that. We've done it with the $45 million we were able to give for public hospitals to start addressing Black maternal health issues. Black women are dying at 9.4 times the rate as their white counterparts during childbirth, and we're now dealing with that in a more intentional way, with tons of money being thrown into public hospitals, and we will make Brooklyn the safest place for all women to have babies within the next 4 years. And we're going to do more of that type of aggressive and non-incremental work to start addressing more health outcomes in our borough. So I just hope that folks come. It's a couple of days away. I think we're 8 days away from the State of the Borough. Please come, and you'll hear a lot more about what we have in store for Brooklyn.
Well, we appreciate your time this morning, and a happy new year to you, Borough President Reynoso. Always good to have you on the air.
Thank you, Hazel. Thank you, Vanessa. Appreciate you all.